I will now be performing skill 113, which is the assembling of the induction tray and the intubation of my patient. So firstly, I will assemble all the supplies that I need on my induction tray, which are IV catheters, the xylocaine spray if you have a feline patient, laryngoscope with the appropriate blade size for your patient, and then 3 ET tubes that you think would be appropriate for your patient's size, some ET tube ties, the sterile lube, gauze squares, a flush syringe, some eye lube, and a alcohol cotton balls. So an emergency that can occur while or after administration of the induction drug would be that the animal could start vomiting. So firstly, I would ask my assistant to restrain my patient in a sternal position. To determine the proper size of the ET tube to measure, I would use the width of my patient's nose for the width of the ET tube, and for the length, it would go from the mouth down to the scapula. While using the laryngoscope, you would apply it lightly on the tongue while holding the tongue with the same hand and with a gauze square to pull it out a little to have a clear field of view for the anatomical structures that you could see, such as the epiglottis and the vocal cords, and you would also see the opening for the airway. You would not use the laryngoscope blade to move the epiglottis or any of the anatomical structures. It is just to have light. You would take your dominant hand, so in your non-dominant hand you would have the laryngoscope and the tongue holding. With your non-dominant hand you would then insert the tube and correctly intubate the patient, and then you would tie the tube. So if it was a dog, you would tie it over the maxilla, and if it was a cat or a smaller dog, it would be tied behind the ears. And then you would connect the breathing circuit and the oxygen to the ET tube, and you inflate the cuff using the positive pressure ventilation to confirm that the cuff is properly, that the ET tube is properly inserted, and to determine how much air you need in the cuff, you would listen and hear if there's any air coming back out.